Mendocino County, welcome to our COVID-19 Friday update. Today we are joined by our health officer, Dr. Andy Coren, our behavioral health director, Dr. Janine Miller, our air quality district director, Barbara Moed, CEO Carmel Angelo. We also have Kelsey Rivera, our department operations center manager. We're going to start today off with CEO Angelo. Carmel.
Thank you, Sarah, and good afternoon to our media and to the public. We very much appreciate the opportunity to speak with you once a week and to give you the latest information about the pandemic response here in Mendocino County. You know, we knew that at some point in time we would have this convergence of emergencies. And over the past week, that's exactly what happened. On September 7th, when the Oak Fire started here in Mendocino County, I declared a local emergency. Today at 5 o'clock, we are having a special Board of Supervisors meeting with one agenda item, and that agenda item is the ratification of the local emergency paperwork. Additionally, Dr. Coren declared an emergency along with me for the air quality as a public health emergency. So as we thought, and as my colleagues up and down the state thought, we would reach a point where we would be dealing with the response for a pandemic, dealing with wildfires, and the possibility of a public safety power shutoff. I would like to assure the public that Mendocino County has been and continues to be prepared. Just as last year, we continue to meet as staff on a regular basis in order to prepare our services and our buildings for a public safety power shutoff so that we could continue to provide essential services to the public. Along with that, today we have Dr. Coren, who will not only be giving you an update, but will also be talking with a couple of our other department heads around some of the issues that are key to Dr. Coren in his response and in keeping the public safe. So I think at this point in time, I would like to go ahead and go to Dr. Coren. Please know that, again, Mendocino County is in a response mode. We have our Department Operations Center open, responding to our pandemic. We have our Emergency Operations Center open, responding to fires. So with that, I will go ahead and turn it over to Dr. Coren. Thank you.
Andy, you're muted.
Thank you, CEO Angelo. We here in Mendocino County, as you know, are currently facing three health threats. First, the pandemic continues to be widespread, and I'll report on this in a minute. As a result of the prolonged shelter in place, social and mental health stresses involving adults, seniors, and our youth are going to be addressed. They're very prominent, and Dr. Janine Miller has been invited in order to help us with that issue. And as you know, the heat and the fires and the smoke and fumes in the last week has reduced our air quality tremendously. In the last couple of days, Willits was the worst air quality on Earth for a couple of days. I think they're out of that right now. We know that the hardships that everybody is facing are very severe, and we are working together to try and find, with the state, some good suggestions to relieve these three problems together without increasing our risk. We want you to be creative. If you have suggestions, we're open to hearing them. We're going to try and be creative. And let me get on with the pandemic stats. I wanted to have this up and share the screen. Let me see if I can get this screen shared. I'm going to have to learn how to do this better. Am I the speaker, or does someone else share the screen?
Hi, Andy. You should be able to share your screen, but if you're unable to, you can continue talking and we'll work on getting that up momentarily.
Okay. All right, that's fine. So we are currently in the purple widespread tier in the tiered recovery pattern that the state has laid out. And those are based on statistics from a week ago. And as we look at those statistics today, the case rate, again, a 7-day average, 7 days ago or 7-day lag, is 9.86, and that is up 1. And our percent positivity rate has climbed a little bit to 3.16 compared to a week ago. Interestingly, our doubling time is actually slowly creeping up, which is good. It's taking longer to double. But we are facing 778 cases. That's up from 724 a week ago, 54 more. We have 69 people in isolation, up from 64, I think it was. I wrote it down. Yes, and at this point in the hospital, we have 1 in the hospital, 3 are in ICUs, only 1 in our ICU here in Ukiah in Mendocino County. 1 is in San Francisco and 1 in Kentfield. Our total deaths in our county is still 17. 5 of them are Latinx. These numbers have not changed in the last few weeks. You'll notice a bump from Labor Day. We attribute that, and it probably will increase over the next week to 2 weeks. The evacuations and sheltering that we've had to do because of the fires will probably increase the transmission rate, so our cases will probably climb. It is important to understand that these numbers get multiplied by an adjustment factor, and that is related to the number of tests that we do in our county, so that our color, our tier level can be positively influenced, can be improved if we test more. We want to encourage people to test because the test results come out within 1 to 2 days, or within 2 to 3 days now, which is much more rapid than it was a week or so ago. We also uncover asymptomatic people and pre-symptomatic people. Many people with COVID who can transmit that disease to others do not have symptoms. So it pays to get tested. And if we find them, then we can contain that group of people that may have been exposed to infection, so we control the infection. There is still a big disparity showing between the non-Hispanic Caucasians and the Hispanic cases. And we are trying to do more education with visual aids with our partners, Zoom meetings with leaders, including UVA and NCO. The state, CDPH, California Department of Public Health, is still working on ways with complex statistical tracking to see how our efforts are doing to reduce the racial cultural disparities, because tracking these numbers helps us to improve. Gatherings are still a very big issue, and we're improving tracking at religious and other ceremonies at this point since we released new orders last week. But the unauthorized parties are the most out of control. So over Labor Day, there were some large parties on the coast. It is hard to try to avoid being invited to a party when we've been apart for so long. But remember that protecting your friends and your families and people in your household, the people that you love, depend on staying away from those parties. I want to remind people also at this point, before moving on to the next topic, that the census is going to be closing in the next couple of weeks. We want you to fill out those census forms. It takes about 10 minutes online. It increases our funding and services from the federal government. It only happens once in 10 years, and we've got to improve the numbers of people who fill the census out. I'll move on to the fires and evacuations. As you know, north of Willits, the 101 was closed. It has since opened. The parts of Willits, in particular Brook Trails, was evacuated, and they're beginning to repopulate that area safely. Also, Trinity and Humboldt counties were also evacuated, and they had to pass through Mendocino. So in response, we set up 2 shelters in Willits. They are now closed because people are repopulating Brook Trails. And we also opened another in Covelo, and I think there are only 4 people still in the Covelo shelter. It's important for everybody to know that even though you're going to a group living situation, we have identified, when we do evacuate an area, we have identified those people who should be on isolation and quarantine, and we're sending them to another quarantine area here in Ukiah. And we are also providing personal protective equipment, social distancing, and masking at the shelters to keep people safe from COVID as they try and remain safe from the fires. We are also assisting tribes up north who are setting up their own shelters for our Native American neighbors. I want to say another word before I turn it over to Dr. Miller. We're going through some terrible stresses here in Mendocino County, and the shelter-in-place orders and restrictions because of COVID have made people very frustrated, very anxious, and so on and so forth. And what dawned on me this morning was that today is 9/11. 19 years ago, we lost 3,000 lives in New York City in a terrorist attack. COVID lost us 23,000 lives in New York. In defense against that attack, our wars in Iraq and Afghanistan cost 10,000 American lives, not including the hundreds of thousands of civilians. And COVID has already cost us in the United States almost 200,000 American lives. So this is a war. This is a war against a virus. And our weapons at this point are 6 feet of distance, soap, and masks. We're all suffering to defend each other. So masking and distance and hygiene is patriotic. Sheriff Matt Kendall said we are stronger together, and I want to accentuate that and add to it that we need to mask up Mendocino. So having said that, I'm going to turn it over to Dr. Miller, the director of our Department of Mental Health.
Good afternoon, Dr. Janine Miller, Behavioral Health Director for Mendocino County. Behavioral health and recovery services and our providers within our community are still providing mental health services. The county specifically, specialty mental health services and substance use disorder treatment services. Services are being provided through online platforms, telephone, and limited face-to-face services. Behavioral health has a warm line available to our community to provide non-crisis emotional support for residents that might be feeling stressed, isolated, overwhelmed, or that just need some additional support. The Mendocino County Warm Line number is 707-472-2311 and also 1-833-955-2510. And the Warm Line is available Monday through Saturday from 7:30 a.m. to 6 p.m. The Warm Line offers bilingual staff and also has translation services available for free, so we're able to provide those services in any language. The state of California also is offering a newer peer-run Warm Line for all residents of the state of California that provides non-emergency resources for anyone in California also seeking emotional support. It is provided via web chat and telephone, and is provided through peers. So this Warm Line is run by peers. That phone number is 1-855-845-7412. Behavioral Health just started offering online support groups to our community. There are a variety of group topics, and they are being offered for free to everyone within our community through a Zoom platform. Behavioral Health is also offering these groups in both English and Spanish. We are looking to expand the Warm Line and provide some additional groups in the future. Those difficult situations differently. It is normal to feel stressed and worried during a crisis. Knowing that these are stressful times, we wanted to provide some additional information on how to recognize that stress may be impacting you, and also some tips on how to manage stress in these situations. So, common signs that we see when we're feeling stressed: fear and worry about our health, our jobs, our finances, and our loved ones; change in our sleep and eating patterns; difficulty sleeping or concentrating; headaches; grinding our teeth or clenching our jaws. We may feel more tired or exhausted than we normally do; have muscle tension in our neck, shoulder, and face. And we also see an increase in tobacco, alcohol, and substance use. Some additional signs that are common in youth that we might want to look forward to is excessive crying or irritability, returning to behaviors they may have grown out of; excessive worry or sadness; unhealthy eating or sleeping habits; irritability and acting out behaviors; poor school performance; difficulties with attention and concentration; and avoidance of activities they enjoyed doing in the past. So, to look at some tips to help us manage our stress in these times, some good tips are making time to unwind by doing activities that you enjoy, connecting with others, and since we need to maintain social distancing, so we really recommend contacting by phone, text, online platforms, or email; taking a break from watching, reading, or listening to the news; taking deep breaths, stretching, doing meditation; exercise; getting plenty of sleep; avoid excessive alcohol and drug use; listening to music; spending some time in nature; spending time with the family pets; and taking some brain power breaks. So doing puzzles, crosswords, Sudoku, some things that really make you use your brain. Additional tips to help with some of our youth out there: talking with your child about COVID, reassuring children that they are safe, letting children know that it's okay to be upset with what the changes that are going on right now, helping them keep their regular routines as regular as they can be with the pandemic. Create a schedule for learning activities and also relaxing and having fun so that it's not all just learning. Make sure you add those fun activities in there. And spending time with your child in meaningful activities. So making sure you really spend some time with them right now as they need it. And I am going to pass this on to Barbara Moed.
Here we go. Thank you, Dr. Miller. Good afternoon, all. I'd like to start with our air quality advisory, or alert actually in this case, for the next few days. As you probably are aware, the nearby August complex fire, well, it's now listed as the largest wildfire in California history. It's about 475,000 acres currently. And it is continues to produce significant dense smoke. And so due to the active fires in Northern California, Oak Fire included, obviously, and stagnant meteorology, unfortunately, we can expect widespread haze and smoke to continue within our county for the next few days. I wish I had a better forecast, but I don't. However, the extended forecast offers some hope of some relief approaching in the middle of next week, with higher humidity and smoke dispersion. Currently, smoke from the surrounding wildfires remains elevated over our county. However, due to fluctuating wind directions and a high-pressure ridge over California, the smoke aloft may fall to the surface at any time, bringing very unhealthy to hazardous air quality conditions to the area. So currently, our air monitors are showing particulate matter concentrations in the unhealthy for sensitive groups to unhealthy for most parts of the county, and very unhealthy to hazardous for Willits and its surrounding area. Inland communities may also experience episodes of very unhealthy air quality. On the coast, air quality has degraded to the point where they're experiencing unhealthy air quality conditions. Good air quality conditions may return to the coast the middle of next week. So, and as I mentioned, the meteorology forecasts we expect much of the same until the middle of next week. So, unfortunately, expect current conditions to continue. Extreme fire weather conditions with persistent high pressure. No, I've said that already. Consecutive days of warm, dry air have increased fire activities, and fires are continue to popping up. And that creates more smoke, of course. So, therefore, while surrounding wildfires are active, expect unpredictable smoke impacts to air quality, followed by multiple periods of some relief throughout the next few days. So that brings me to how can we deal with these smoke impacts? Smoke impacts in heavy concentrations, we know, can cause eye and throat irritation, coughing, difficulty breathing. Even healthy adults can be affected by smoke. So when air quality conditions are unhealthy, everyone should limit prolonged or heavy exertion activities outdoors. Cloth facial coverings that are used to slow the spread of COVID offer little protection against wildfire smoke. They do not catch the small, harmful particles in smoke that can harm your health. Therefore, the Air Quality Management District recommends these general precautions to protect your health during a smoke event. Minimize or stop outdoor activities, especially exercise. Stay indoors with windows and doors closed as much as possible. Do not run fans that bring smoky outdoor air inside. Examples would be swamp coolers, whole house fans, and fresh air ventilation systems. Run your air conditioner only if it does not bring smoke in from the outdoors. You can change the standard filter on your air conditioner to an improved efficiency filter. If you have a recirculate setting on your air conditioner, please use it. Also, this is a very, I think this is the most protective advice we have for our residents in the current air quality conditions. We recommend you seriously consider creating a clean air room in your home. This will actually protect you from COVID as well as smoke impacts. And that's why we're recommending that this year. You can create one at home using a purchased or a do-it-yourself HEPA or high efficiency particulate air purifier. And I've got some, let's see, I've distributed some posters on these subjects, which I believe will be posted to the county websites. So I'd like to spend a few minutes talking about how we can create a clean air room. The first thing you would want to do is pick a room that you spend a lot of time in and that can fit the members of your family, your small social bubble, if you will. And what you want to do is, as I said, you want the windows and doors closed. You want them tightly closed. You want to keep outdoor air from coming into that room. Then the next thing you would want to do is either make or use a Hepa air filter. Now these can be, they reduce particulate matter by as much as 90%, which is great. And you can purchase them at hardware stores or online retailers. One moment, excuse me. My battery's about to go dead. They come in various makes and models suitable for different size rooms. And if you're interested in buying one, you can, they cost about, anywhere from $75 to $150 for a bedroom size room, say. And you could go to California Air Resources Board website. All you have to do is Google air purifiers and you will pull up a list of air purifiers that are certified by the Air Resources Board. You want to avoid a Hepa air purifier that generates ozone. This is not good. This is not good for your health. So, and then the other thing is that if you start filtering the air with the HEPA purifier, the other thing I want to say is you can actually make one of your own. You don't have to purchase one. And we've got, you can make it simply with a 20 by 20 box fan and some air filters rated MERV 13 or higher. And this, I think, can be done for between about $40. So hopefully this is within reach, these costs, of every household. And we really, this is the best we have to offer this year. You know, normally we would be talking about N95 masks, but we all know they are being reserved this year for healthcare workers and front first responders. And so, you know, and the cloth facial masks that we use to protect ourselves from COVID offer little protection from a particulate matter in wildfire smoke. So please consider this. You would be much more comfortable, I believe, if you do so. In addition to creating a clean air room in your home, you also would want to minimize other sources of indoor pollution. You know, for example, frying food, using candles, don't smoke or burn firewood. Use your range hood when you're cooking. Yeah, I think those are the main points I'd like to cover.
Thank you, Barbara.
You're welcome.
Next, we'll move over to questions from the media. We have 2 questions submitted by Matt Lefevre with KMUD, so we'll start with those written submissions. The first question is, this week's modifications of the shelter-in-place orders allows weddings as long as the guests are adhering to social distancing. Humboldt County Public Health announced this week a 50-person gathering in southern Humboldt resulted in 22 cases of COVID. What can you tell the Mendocino County public about the collaboration being done with local venues for cultural and religious events to provide guidance and ensure best practices are in place?
I guess I should answer that. We did permit weddings and other cultural events outside of churches, but they're still all to be outside. So a private venue could be utilized, but it's outside. The distance should be maintaining the 6-foot distance between people if they're in different households. And we are still not allowing chanting and a lot of singing, but outside singing is a little better. We just want to make sure that people are not singing at each other and singing loud. The other thing we've done this week is we've asked people who are having gatherings, for example, the churches, to keep a list of people who come to the weddings or the ceremonies. And that would be whether it's a church or whether it's a non-religious venue. Keep a list of the people that come and their phone numbers and just fold them up and put them in a drawer so that if Department of Public Health needs to do tracking of someone who's turned out to be positive on the COVID test, it makes it easier to track down those people who may have been at an event with a person who's a COVID case, and also warn them for their own health, and also to keep them under quarantine and get them tested if it's warranted. We track them down and investigate them. So the main things are that when you are at one of these events, it's not like everybody hugs and kisses and touches in the old days, but we keep our 6 feet apart. We stay masked. We make sure we keep our hands clean with the sanitizers or washing up. And in that way, we try and minimize the transmission of COVID.
Thank you, Dr. Coren. And just to remind the public, The businesses in our community, including the venues, are required to self-certify and have a COVID protocol in place through our Mendocino County business website. So moving to the second question from KMUD, there have been reports on the national level of the potential of a vaccine by the end of 2020, maybe even sooner. First, what are your reactions to this timeline? Is it an accelerated timeline? Second, what distribution mechanisms has Mendocino County considered as the potential of a vaccine is on the horizon?
We are looking at that from the point of view of how would we do, how have we done influenza vaccines. To have a vaccine that is safe and effective, ready before January 2021, let alone before the election, I think is very, very unlikely. AstraZeneca just stopped one of their trials because there was a very serious reaction on one of the people who did use the vaccine. We don't know if it's a cause and effect, but when that kind of thing happens, a lot of examination has to go on so that we make sure that whatever we're putting into people, we're not causing worse consequences. And this is the problem with vaccines. Vaccines are given for the most part to people who don't have disease. We don't want to make them sick. And we don't know that every vaccine is effective. In fact, the vaccines we have now that we consider very effective are in the range of 90%, 95% effective. The less effective ones may be as little as 50%. So we certainly don't want to risk giving someone internally a product that may cause harm. I know that there's a lot of other interests and forces at work to try and promote, the early vaccine. But on the one hand, from a scientific point of view, the experience has been, it's very, very unlikely. The United States is giving a lot of money so that it can be produced at a massive level once they find something safe, but the finding something safe and effective is the big problem. Finally, there's distribution. It would be a huge jump to think that we could distribute hundreds of millions of vaccines quickly. So at this point, our defense against COVID is the social distancing, the mask, and the carefully cleaning ourselves and the environment around us. That is the way that we fight it.
Thank you, Dr. Coren. We'll move next to Sarah Wright with KZYX.
Hi, thanks a lot for doing this. My first question, I think, is for both Dr. Coren and Director Moed about the bad air quality. We know that people who are already suffering a respiratory illness have already shown up in the emergency rooms and feel the effects immediately, but can you talk a little bit about what the long-term effects are for people who may feel fine during this time, but could get sick later on, and what kind of symptoms should people be looking out for and take care of their health in the long run?
Well, since I'm unmuted, I'll go first, Barbara, and then I'll let you pick up after me. These kinds of fumes and particulates are going to set off people who already have asthma and who already have chronic lung disease like emphysema or bronchitis. And for those people who have heart disease, they are going to be suffering more if breathing is a problem. But these fumes can have other effects that we don't know of. When forests burn, we know some of the hydrocarbons that are in the air. When houses burn or buildings, there's all kinds of petroleum products that can carry some long-term effects that we don't yet know. We won't be able to diagnose for a while. So the best advice is to stay away from it. The long-term effects of smoke, the smoke that we have in the air can be worsening of emphysema, which is irreversible. And of course, if a person gets terribly sick, they're going to wind up needing oxygen and possibly being in a hospital. So those are pretty severe problems. And I'll turn it over, Barbara, if there's anything more that you can add.
I actually have nothing to add. Thank you.
All right. Did that answer your question, Sarah?
Yeah, I'm just wondering if, a few months or even years down the line, there would be possibly lifelong implications, especially for kids who are exposed to this kind of air quality for a long time.
The long-term implications for COVID are starting to come to the fore. And they can be cardiac, neurological, pulmonary, and probably a lot that are undiscovered. I was reading last week some research that was being done that shows a defect in the heart muscle that happens with COVID that could lead to long-term congestive heart failure. The whole problem of our sheltering in place and having schools closed, we very seriously worry about what that does for children at developmental ages where they really need to learn various different behavioral controls, playing nicely together with others, attention, and they need to read. People who don't learn to read by the third grade have very, very long-term problems. I can't tell you in terms of smoke specifically, except for the long-term risk of emphysema and bronchitis, what those long-term effects could be. But the COVID long-term effects is something that's definitely on the researchers' minds.
Okay, thank you. And my next question is about a Mendocino County resident who showed up on the dashboard yesterday as having passed away out of county. And I'm wondering if you could talk a little bit about that and if we have lost more of our residents in out of county facilities when they're trying to get higher level of care.
Well, certainly there are some patients who get sick enough in our own acute care facilities, and it is appropriate, whether they have COVID or anything else, to refer them to a higher level of care. Usually that's University of California, San Francisco, where there's much more available interventions and interventionists who are very skilled. In the cases that occurred out of county that were reported actually mistakenly on our dashboard yesterday, these were people who were actually in long-term care for other reasons, and then they got sick in those counties and they passed away. In gathering the statistics, there are certain rules that we try and follow so that it's done consistently. And I think when we found their permanent residence was still listed on the nursing home records as being Mendocino County. I don't actually know whether that's because they are family here still or whether they had been here, but they had been there for a very long time. So although they appeared on our records, they actually didn't acquire the disease in our community and they didn't pass away in our community. So from a statistical point of view, they were not deaths due to COVID in our county.
Okay, thanks for clearing that up.
Thank you, Sarah. Thank you, Dr. Coren. Moving over to the Independent Coast Observer, Susan. And you're currently muted.
Hi, I was going to ask about that also, the person that showed up as a death and then disappeared as a death. And I wondered if it could have been confusion caused by somebody living in Sea Ranch, which is in Sonoma County, but many people there do a lot of their business and medical business in Mendocino County. So I'm still not 100% clear on what the answer was to that. It was someone who was at a nursing facility in Mendocino County, which would make that person a Mendocino County resident, I would think. And
yes,
then
my understanding is that they actually were not in a Mendocino County long-term care facility. They were in another county. And so they've been there for some time. They got sick there and they passed away there.
So the whole thing was a mistake.
it was a mistake in attributing it to Mendocino. I mean, we're all mourning and sorry that this person passed on, but from the point of view of following our statistics in order to, address the COVID epidemic, it didn't apply to us.
Okay, great. And I wondered if you could say something about these large gatherings that are being pointed to as the root of the problem. Are these gatherings taking place in Ukiah, and are they mainly of the Hispanic ethnicity? Is that why those numbers are so big for those two factors? And are they mainly people between, I'm guessing, 19 and 49?
Well, your first part of your question, do I have anything to say about the gatherings? I have a lot to say, but I think for purposes of we're on public radio that I won't say all of them. They are a major cause outside of transmitting within a family. They are a major cause of the reason for our numbers to be going up, and they are unauthorized. They are dangerous. It's not only that there are people gathering, but they're not using social distancing. They're not using their masks. They're not washing up. It's a good old-fashioned party. And, I can understand why they'd be in a party. We're separated so long and we're sheltered and hunkered down. We want to get out on a Saturday night. But these, there were a couple on the coast, I know, at least a couple that I know of. I think there were more than that. And these were large gatherings, hundreds of people. And under those circumstances, this germ just has free reign. It's going to go around and attack anybody that it can get to, and it's going to latch onto their cells and invade their bodies, and it'll cause them infection, and they won't know about it for a few days, and they may not be symptomatic for longer, and they'll pass it on to other ones that are their friends, that are their loved ones, that are people they don't really want to get sick, but for that evening of fun, they chose to put themselves and their families and their loved ones in danger. I don't think that it is. I don't think we should attribute it to the Latinx community. It is also Anglos that are doing this, and the unauthorized ones. The large parties, as I understand it, have been more on the coast and in places where it didn't just involve Latinx people. So we certainly don't want to get into that. There are reasons why the Latinx community is suffering more. And I'm going to be honest, I don't know all of what they are. I do know that there are cultural differences that we're trying to understand. And we're trying to have the Spanish community, the Hispanic community, intervene on themselves. This is not something where we want to be paternalistic or accusatory. This infection affects different communities differently, and our livelihoods and our lives before affect us differently. A great deal of the people from the Hispanic community are in work like the agricultural workers, where they work together, where they bunk together, where they transport together, they share phones, because they're terribly poorly paid. And that's true for other people in the Hispanic community, where they're working in service jobs, food preparation, house cleaning, home care, care of elderly people, and they're an incredibly vulnerable community. I can't tell you honestly that I know all of the reasons why there is that disparity, but the disparity is something we desperately want to understand and get on top of, both here at the county level and at the state level. And there will be other ways that we're going to want to be tracking it in our county and around the state, so we can get a handle on why and get it under control. Susan, did that answer your question?
It did. Thank you so much.
Okay.
Thank you, Susan. Next, we'll go over to Adrian Bowman with the Mendocino Voice.
Hi, Sarah, Dr. Coren. Thanks for having us. I wanted to begin by asking if you have any specific numbers around the parties. I assume that Dr. Coren mentioned a couple large parties on the coast. I assume that you know about that because somebody called authorities to inform that those parties were happening. So in those cases, did the sheriff or another regulatory agency show up to break up the party? And given that, do you have numbers around how many of these large parties have happened over the last week or a couple weeks? And could you make those generally available, perhaps as part of the dashboard?
That's a great question, Adrian, and unfortunately, I'm coming up empty. I can't tell you how many of those gatherings or parties there are. I did hear of one on the coast that was supposed to be 1,000 people, and it was visited by authorities, and their estimate was it was probably over 1,000, maybe as much as 2,000 or 3,000. So that was a huge, it was like a rock concert that happened. Another one happened down at Bodega Bay in a similar way. And with the roads that we have in our county, when there are calls to these distant places, the congestion is terrible, and we can't get out there. And this is not just calls for COVID, but when you've got that many people in at one time, it creates tremendous hazards in many different ways. So I don't know. I think that's a great idea, and we should be capturing numbers. Unfortunately, when they are reported, they're usually reported after the fact. And when our enforcement folks get out there, they're often gone and dissipated.
I got to ask a follow up to that. Perhaps CEO Angelo could comment on a 2,000 or 3,000 person event. Where was that? Who organized it? Were fines given out to anybody? Is there any details about that?
Adrian, this is Carmel. I apologize. I have no details on that.
Okay. Would it be best to talk to, oh my God, I'm sorry, his name's escaping me.
Hi, Adrian. Yes, we can connect you with John Martyr from the
Yes. Sorry about that.
investigation unit.
Great. My second question is, again, for Dr. Coren. I'm wondering about your choice to use the highly militaristic language to describe the efforts against COVID. What do you called it a war? And I'm wondering what you mean. Clearly, it's not a war. We can't have a war on a virus. Wars are fought against other nations or people. I'm wondering what you see as the value of describing this public effort in these militaristic terms, and why you choose that kind of language.
Well, I think that what's happening is that with the restrictions going on as long as they are, there is a lot of politicizing of the ordinances and an effort to lay blame. There is no doubt that people in the community are suffering. Individuals, businesses, and so on and so forth are suffering. And the California Department of Public Health, and the county's Department of Public Health, and all throughout the state, what we're trying to do is chart a path safely to the end of this thing, to where we can get COVID really under control. The reason I used the analogy to a war, and actually likened it to a war, is because we have lost almost 200,000 people in the last 6 months of suffering from this pandemic. And although people are suffering, I think that we need to keep in mind that there are people dying in great numbers, and that we all have to do our part. I don't like going out with a mask. I forget it some of the time. I have to go back and put it back on. I don't like washing my hands all the time, although I've been doing it for years and years and years as a physician. And the social distance is something I really don't like. I'm kind of a guy who loves a hug and a kiss. But we put that aside, and I like to go to parties, and we all like to dance. We like to, that kind of contact is, it's necessary actually in some ways. We were talking about the mental health. Not having that causes suffering. But there's greater suffering from those people and those families who died. And so I want to remind people in the community that masking, social distancing, closing certain businesses down is a sacrifice that we make for each other. And that's a similar kind of thing that we do in war.
Okay, thank you, Doctor.
Thank you, Adrian. We have time for just a couple quick questions from our viewers. The first one that I came up was, do you have a best guess or estimate of when we'll move to the next tier on the state's reopening tiers? Currently, we're in tier 1, purple, widespread.
Yeah. Well, my greatest hope is that we'll do it in another couple of weeks, but my realistic appraisal is it'll probably be the following 3 weeks. Now, there could be some changes in that estimate, both by our testing a great deal, our not having a large surge as we expect from Labor Day and from the fires and so on. And there could also be some changes in the overall plan at the state level. However, the state level plan has been developed so that we can slowly reopen and observe what the effects are at this point at each step of the way. Remember, in the spring, everything was shut down, and then we opened up quite a bit around May, and then we had Memorial Day and July 4th, and everything was open, and we had this huge surge. And so I don't think that we're going to step away from this program, the tiered program, very soon, because there's data that we want to gather, and we want to stay the course so we can figure out what we need to do. What I'd like to see us do is make some of this tier a little bit more tolerable without exposing more people to COVID, and that's what we're trying to do.
Kind of tearing off that, there's a lot of comments. Really, what people want to see gyms open. No, we're under some state restrictions. So, one, can you talk about is there any possibility of that happening, even though we're in tier 1 with negotiations with the state? And then, second, what tier allows gyms to reopen?
Oh, that's a good question. No, I have it here. I think. Let me see if I can find it quickly so I can not speak off the top of my head. Here we are. I am pretty sure that it's in tier. Just give me a second, I will find this. Yeah, so in the red level, tier 2, so it would be the next one, gyms would be allowed to be opened with a 10% capacity. So as you can see, it's opening certain industries, but it's opening them slowly so we can observe, well, what's the effect? If we open a gym and 100 people use it in a day, then it goes on for another 3 weeks before we find out that actually that's caused 5,000 people to be ill. Whereas if we open it 10% at a time and we observe and we keep our wits about us, we may be able to control it more and not cause more illness that way. If we find, on the other hand, that opening at 10% is not increasing our numbers greatly, then the next step, the orange tier, tier 3, the maximum capacity would be 25%, and there would be an allowance to open indoor pools. And at the 4th or minimal level tier, which is yellow, we would have indoor saunas, spas, steam rooms, but a 50% capacity. So remember, while this tiered program is very restrictive, its intent is to actually let us open. It's just letting us open slowly so we can do it intelligently and not cause illness.
Thank you. So it sounds like the gyms reopening really comes down to these requirements at the state level. And if we can get to the next tier, we'll see some relief and gyms will be able to open, but with limited capacity.
Yeah. And it could be sooner than I would have said when you first asked the question. So the red tier, next tier, let's work for that.
That's good news. We have time for one more question really quickly. Can you explain community spread and why it's gone up so drastically? And, our DOC manager might also have some additional information on why we're seeing, what does community spread mean and why are we seeing that increase?
We oftentimes see that increase because of the unauthorized gatherings that we've talked about. We can't pin them down. That's what we think is probably the main cause under community spread. But it's not something that we can definitely identify. Oh, it was that event. It's not under investigation. The cases have passed. We can't further investigate. It is not from a workplace outbreak. It's an unknown at this point, but we believe that that's the major cause, that parties are the major cause of community spread. Kelsey, do you want to add something to that?
Sure, thank you very much. I would just like to add that one of the reasons that we're seeing it come forth on the data tracker is that now that we have been able to gain more staff and be able to really streamline our activities in the DOC with our contract investigators, contact tracers, we have been able to really focus on data that we have not been able to finalize. So we have been going through all of the cases. If you notice that there are many cases that say, oh boy, it's escaping now. It's not unresolved, but
under investigation.
Under investigation. So we know that we have been tracking those cases. We just haven't been had the bandwidth to be able to make sure that we have that updated. So we are now, we have pinpointed somebody to make sure that we are really focused on the data and that we are cleaning it up and making sure that we have clear data and cross-referencing all that information. So the under investigation cases, as we are reviewing that case and looking at when it was closed and how those people came into contact with COVID, we are then updating and resolving those issues and noting whether or not they were came into contact through travel, work, or close contact or community spread.
Thank you. That's all the time we have for today. I just want to thank all of our guests today, Dr. Janine Miller, Dr. Andy Coren, Barbara Moed, our CEO, Carmel Angelo. Later today, we will be posting a recap in English and Spanish, as well as a clean air advisory notice in English and Spanish. And remember, we will have a special Board of Supervisors meeting today at 5 p.m. with one item to declare an emergency regarding the fires and the air quality. So you can join us later today for that. We thank you for joining us. Have a wonderful and safe weekend.
Thank you.